We're back with CDC Director Dr. Rochelle Walensky. Now, there's people having trouble getting tests. There was a big scramble. And I know that the president announced that the U.S. government is going to make 500 million tests available to the American people in the weeks ahead. Some people have been asking the question, well, why didn't y'all anticipate this before the holidays? Isn't that when we would need the test? Do you think there's some validity to the criticism that there wasn't enough anticipated, what's the word, prevention of the disease by allowing these tests to be distributed earlier?
Right, so we recognize we have to do more. We recognize in areas, especially in areas that are surging, it's really hard to find these antigen tests. There are PCR tests that are available, and we've been scaling up new federal PCR testing sites. We've authorized several new antigen tests. We're using these antigen tests really smartly in test to stay to keep our kids in school and higher education. And there was this confluence of events of Omicron hitting and surges just at the holidays when people wanted more tests to gather.
It costs about $14 to get an Omicron test at Walmart, or a COVID test at Walmart. At CVS or Rite Aid or Duane Reade, that's a $24 test. Do you think there should be regulation in making the test cost the same everywhere?
Yes, but it shouldn't be that price.
What should the price be?
You know, I think we have a responsibility in this pandemic to take care of the people who have been hit the hardest. And that access to these tests, especially among vulnerable populations, racial and ethnic minority populations are essential workers, so that they have access to the tests, not at $24 a pop. So I would like those test prices to be far lower.
And how would that happen? Who would do that? Would that be the FDA would mandate that? Would Congress have to pass a law? Do you happen to know what the mechanism would be?
It wouldn't be through FDA, and it certainly wouldn't be through CDC. It may be through CMS or other regulatory agencies.
I'm sorry, what's CMS?
The Center for Medicare and Medicaid.
Now, I have always been an admirer of America's disease response teams, for lack of a better word. I thought the CDC is an excellent organization, that it exists. It's a model for other organizations around the world. It had a real hit to its credibility during the last administration because of bowing to pressure from political figures who were put over the CDC, specifically people like Dr. Scott Atlas and Michael Caputo, all changed the guidance by the CDC and put out notices that were inaccurate and possibly cost people their lives. And that was eventually corrected by the CDC, but it really put a hit on the CDC's credibility. What are you doing to restore public trust in the CDC?
I think there are two pieces to that. One is I have to make sure that the people of the CDC know that when they produce good science, that it's going to see the light of day. Because that was, they took a hit too, and these are 12,000 people who have been up, you know, the card says 24/7, and that's really what they do. They're up 24/7 protecting America's health. So my job was to make sure that their voice was heard and to make sure that the science could get out there. And then my job was to tell America that I'm leading with the science. And it's hard and it's complicated and it moves and it changes. And then I'm here to talk about it and to be honest with where we are.
That is one of the things that it's a simple thing to say, but for some reason some people can't accept it, which is, well, why do y'all change what your guidance is? Because you learn new things.
Every day.
But as long as you can back it up with science, I am so glad y'all are willing to change your mind. And good luck to all of us, and thank you for what you're doing over at the CDC. Give my best to those 12,000 people.
I absolutely will.
Thank you, Doctor.
Thank you.
Dr. Rochelle Walensky, everybody. We'll be right back with the star of CBS's Ghosts, Utkarsh Ambudkar.